Thank you for joining us today.
Thank you for having me.
So I would love to hear a little bit about your practice here in Marietta, Georgia. Can you tell me about your practice and how long you've been practicing?
Well, it's hard to believe I've been practicing now since February, 20 years. And it's a full-service chiropractic facility and helping one patient at a time.
So we are here to talk about laser therapy, and I'd love if you could tell us what laser therapy is and how long you've been using it in your practice.
Well, I've been using it in my practice predominantly just a little bit over 3 years. Keep in mind that laser therapeutics predominantly is utilized for the decrease in pain. It also mitigates inflammation, and it also upregulates cellular recovery and healing in the tissue.
That sounds amazing. How did you first hear about laser therapy?
I first heard about laser therapy back in on or about 2001. I was working out of a facility. They had a much lower wattage system back in those days. And, that's when I noticed I took interest in it while I was obviously utilizing other adjunct treatments in my day-to-day chiropractic visits.
Do you treat a lot of your patients with laser therapy?
As a matter of fact, I do. Recently, we pulled up a stat on the utilization of the laser in conjunction with chiropractic care. We're hovering right about 75%.
Wow, that's a great number. What conditions respond well to laser therapy?
You know what? Just about everything you throw at it, it's going to respond. But again, everybody's dynamics is a little different. Some patients respond rather quickly. Others will require a little bit extra time, especially with neuropathy cases.
Okay. And speaking of conditions, I know that we have a few patients here to talk to us and that have amazing results. And the first patient we're going to speak today is Rex. And I know you've treated him for phantom limb pain. Can you tell me about phantom limb pain, what it is?
Well, phantom limb pain is a condition that majority of the time comes after an amputation. A lot of times it's due to the fact that the nerve has been severed. There's also an accumulation of scar tissue to the residual limb. And there is a common theory that there is a mix-up within the sensory motor cortex of the actual brain. It's the actual movement of the limb in all actuality in comparison to what exactly is going on. There's a mix-up.
So what is a typical treatment protocol for phantom pain?
Well, the dynamics is a little different. Some patients respond, as something so simple as maybe 12 visits. Other patients may require a little extra amount of visits. The dynamics of everyone's body is completely different from each other.
Yeah. And so why does laser therapy work so well for phantom limb pain?
Well, for starter, it mitigates pain. That's why these patients are coming to see us, reduction in pain. But I've noticed, anytime you improve blood flow, circulation to an area, you're also are helping and upregulating the body to really recover and heal itself.
Great. Thank you for that information. And we're actually going to have Rex come join us now and he's going to tell us about his experience with working with you.
Fantastic.
Hi, Rex.
Good afternoon.
Thank you for joining us today. I'm glad you're here. And I would love to know about your journey of healing with Dr. Crespo. Tell us why you came to see him.
Well, as Dr. Crespo just mentioned, I lost my leg about 4 years ago. I had a massive heart attack, and one of the drugs administered during the open heart procedures cut off all circulation to my feet and hands. So the result was gangrene, and I ended up losing one leg, part of one foot, and a couple of fingers. And I was in the deep throes of phantom pain, more hours per day than I was not. And for me, it was a crushing sensation, much like a steamroller was parked on my foot constantly, the foot that was not there. So when that wasn't happening, it felt like a railroad spike was being driven into my calf. So I was told about Dr. Crespo and that he was trying this laser treatment. And I thought, nothing works. I'll try anything, because the drugs that they were giving me were not working. So I came in, and after his first treatment, I felt a difference. So after just a couple of cumulative treatments, the pain reduction was massive. And I swear by it. It's a wonderful procedure.
Yeah. What would you recommend? Would you recommend this to others?
I do all the time.
You do. I know you do. And what do you tell people about the laser therapy?
Well, one of the things that I do is work with other amputees. And so when people are telling me that they are suffering from phantom limb pain, and 90% of us do, I do recommend this, especially in Georgia. If they're in the North Georgia area, that it may be a bit of a drive for them, but it certainly beats sitting at home and being in pain. So I always tell them it's worth a try. What have you got to lose? And if they're not in Georgia, I do work with people who are out of state. I ask them to go to the Summus website and use the provider finder and find someone in their area. To me, it's worked wonders.
I'm so glad that it has worked wonders. How long was your journey of pain until you found Dr. Crespo?
I was about 2 years in.
2 years of pain.
Right.
Yeah.
And I was one of those people who never thought that I would be one to complain about anything hurting. My life was solid. I went to the gym all the time. I ran a small business. I sang in 2 choirs. I spent time with my friends. Pain was not part of the picture. And suddenly it was. And I couldn't imagine spending the rest of my life in a debilitating pain that medications couldn't touch.
Right. And what sort of medications were you given?
I was given all kinds of opioids initially, and I just couldn't take them. Ultimately, they had me down to gabapentin, and I found that gabapentin caused me problems with continuity verbally. So I would lose a word in the middle of a sentence, and it was like a train rushing down the tracks with my conversation. So the train would go off the tracks, careening into the chasm below, while I was trying to pull that one word out, and suddenly realized I'd forgotten the entire conversation. So my body doesn't respond well to drugs. And I found that I was doing better without it than I was, but I was still in pain. And this seems to have helped enormously. I would say it's about a 90% pain reduction.
So we're moving the probe superior and inferior to the spine, directly over the spinal cord and the bilateral nerve roots, and then going side to side, right over those paraspinal muscles. How's that feel, Rex? Moving the probe nice and slow. Make sure you're saturating that whole area. About 1 minute and 30 seconds into the treatment. Eventually the Horizon laser system will notify me when it's time to move down the residual limb. You doing okay, Rex?
Well, I love that this, like other systems I've investigated, is completely non-invasive.
Absolutely. Again, the brain has an uncanny method of learning. At this point, the system has notified me that we need to proceed to the second component, which is the residual limb. Okay, again, we're starting proximal to distal. And to pick up where I left off, the brain has an uncanny way of learning and relies everything on sensory. Okay, so in this particular case, I'm trying to assist. If we can somehow stimulate that sensory motor cortex, that way the brain understands through neuroplasticity where Rex's limb actually ends now. And by providing that sensory component, his body is trying to learn and understand his movements and the actual perception of the movement. And hopefully they'll equate. That way that phantom limb pain is not triggered. Again, it's my hypothesis, but at this present time, it is working. So apparently we're onto something. Okay. Make sure we get that residual end cap. This is the part that a lot of my amputee patients will basically say to me, it's almost like an awakening. They could actually feel these little nerve endings that have been severed, almost feel as though they're opening up like a little rosebud. Was that how you felt it in the very beginning, Rex?
To me, it was more a matter of stimulating those nerves. I have very good proprioception. I'm very blessed with that. So it constantly feels as if my foot is still there. But by reactivating those nerves, I no longer sense pain that I was experiencing before. So other than a glossy, it was just reconnecting nerve endings that were still there. They're still buried in my leg, but giving them a purpose. I talked to others who said their experience has been exactly as you described.
Okay, we have about a minute left, and which will conclude this procedure for phantom limb pain.
Definitely lets me know that those nerves are still active.
You still feel it, the tingling?
But at least now they have a purpose rather than sending false signals to the brain.
So it's not painful?
Not at all.
Excellent.
So it's very comforting.
Good.
That's my hope.
All right, excellent. That concludes the treatment for Rex. Save it.
So much more relaxed. I don't feel the tension in my leg that I did earlier.
Mm-hmm.
So, feels very stimulated. So I can feel those nerves and they feel very alive.